Today, we're excited to introduce Dr. Abdul Basit, pulmonologist at Lima Memorial Health System Pulmonary Medicine. He's going to be here to share just a little bit about himself and his expertise. So thanks so much for joining us, Doctor.
Good morning.
All right, well, let's start by getting to know you better. So could you tell us a little bit about your background and what led you to specialize in pulmonary medicine?
Of course, I appreciate you having me on the program. I did my basic training in internal medicine in New York City and ended up taking care of some very sick patients, pneumonias, tuberculosis, HIV, and slowly I gravitated towards the field of pulmonology. So after finishing the basic internal medicine training, I did 3 years of fellowship training in pulmonology, sleep medicine, and critical care medicine. I moved to Ohio about 20 years ago to start practicing the art of medicine. And I'm very blessed that over the years have been involved in the care of many patients with good outcomes. I have come to Lima to join Dr. Steinecker in pulmonology practice. We specialize in certain pulmonology and sleep medicine cases, and that includes smoking, COPD, and we'll talk more about smoking in a second, but that includes common problems like bronchitis, viral, bacterial. We just went through a very serious pandemic, once in a lifetime type of situation, and have learned in the process a lot about pulmonology and how the lungs function, and different treatments have come out that can help hopefully in the future. We also take care of lung cancer related illnesses, and lastly but not the least is the sleep medicine, which encompasses a wide array of faculties.
So what's your approach to helping patients manage their lung concerns and conditions? How do you help them?
Yeah, so unfortunately for us, a lot of diseases that we take care of are chronic. If you look at the COPD, the first number there is chronic, meaning a lot of illnesses that we are dealing with are not going to be quick. Most of the time when patients are referred to me, they have already gone through some initial treatment for bronchitis and common ailments like asthma. So we end up seeing patients who are already quite complicated and have been dealing with these illnesses. So for me, the first basic tenet of approach is that we need to educate our patients about their illness, because they will probably end up, for example, if I give you an example, a COPD patient will probably end up utilizing the inhaler therapies, the puffers, to breathe better for pretty much for the rest of their lives. And for us to get that commitment from those patients, it doesn't happen in vacuum. So my approach is very simple, that before I initiate any therapy, I spent a fair amount of time talking to my patients to tell them in layman terms the disease process that they're dealing with and what the expectations are. And so it's basically a team effort where patients and their loved ones, spouses and parents and sons and daughters all have to come together to support the care of the patient. And if you can get that early buy-in, then the rest of the process becomes a lot easier.
Yeah, education and communication are definitely key things. So for those that are watching today, now if they want to learn more about you or maybe Lima Memorial Pulmonary Medicine Services, how can they get in touch with you?
Yeah, there are many ways to reach us. The easiest way will be for this number, which is flashing It is 419-998-8295. They can give us a call. If they have any problems, they can go through their primary care for a referral, or they can call us directly. We are happy to get them in as quickly as we can and start to look over their medical care.
All right, well, don't go away because we have more when we return.